We are back with more What's Now, continuing to focus on your health. Recently, the American Lung Association released new guidelines for screening, and this is especially important for Black Americans as they are more at risk of being diagnosed with lung cancer at later stages. I spoke with Dr. Waters all about this. Let's take a look.
Lung cancer is the leading cancer killer in the U.S., but there is hope. New lung cancer screening guidelines double the number of Black Americans and women eligible for screening. The updated guidelines are also an important step forward in addressing racial disparities associated with lung cancer. Joining us today to bring more awareness to this issue and discuss the new screening guidelines is Dr. Victor Waters, National Volunteer Medical Spokesperson for the American Lung Association. Dr. Waters, thanks for joining us today.
Thank you.
What can you tell us about the new lung cancer screening guidelines?
Well, it's unprecedented. We have a guideline that's impacting the community of color. More than double the Black population and women are now eligible for screening. And that screening is low-dose CAT scanning. And in fact, very few people get screened. In the US who are eligible, only 5%. So this is why I'm here to encourage the use of a very safe procedure to diagnose early lung cancer.
What are the systemic issues that are contributing to health disparities for those facing lung cancer?
Yes, the community of color may not even be aware that there's such a thing as a low-dose CAT scan procedure. And that's a barrier, just the knowledge of its availability. The second is affordability. If they know about it and the costs uncovered by their health insurance carrier, that's another barrier. Today, I can say that more health insurance companies and even Medicare is covering the cost, and it may not cost anything to do the screening. That's very, very important. The other piece is just general distrust, particularly in the Black community, against the healthcare professionals. And that's a bridge that I want to address and encourage people to get this screening because it makes a difference. The earlier you diagnose lung cancer, particularly in the community of color, the sooner that means you can get treated sooner and perhaps save your life.
And tell me more about the importance of getting the word out about lung cancer screening.
Yeah, the word is critical because the fact is it's a leading killer. Now, lung.org screening is American Lung Association's website where they can find out more information and, in fact, do a screening guideline. So the ages, if you're between the ages of 50 and 80, or if you are a 20-pack, you're a smoker, which simply means you've smoked 1 pack for 20 years, or 2 packs for 10 years, qualifies you to get the lung CAT scan. That's very important because you need to go to your physician and they can order the test and you can get screened to rule out cancer.
The American Lung Association has created a new Q&A document to help answer questions about these new screening guidelines. Can you tell us more about that?
Yeah, so between the ages of 50 and 80, and if you're a smoker, which is very high risk, that's the opportunity that the American Lung has these resources to educate and promote the screening process. But keep in mind, the CAT scan itself is very safe and effective in diagnosing possible lung cancer.
And what are some key takeaways that you want our audience to learn, especially from our discussion today?
Yeah, I want to make sure people understand when they hear the term low-dose CAT scan that it doesn't mean they're getting any kind of injection or contrast or oral contrast. This is a CAT scan is simple, multiple x-rays that are looking into your lung, non-invasive, that can detect a potential tumor or cancer. That's it. So I want to make sure that people are well informed that this is very effective and can save a life.
And where can we get more information?
Yeah, please go to lung.org screening, lung.org screening, and you'll have all the resources supported through the American Lung Association.
Well, thank you so much, Dr. Victor Waters, for joining us today. Really appreciate your time in discussing these important lung cancer screening guidelines. Thank you so much.
My pleasure. Thank you.